It's Dr. George Lee here. I guess this is for the last installations of testicular problems, right? I would like to share with somebody or anybody listening out there about testicular cancer, right? Okay, most people would think cancer only happens to older men, right? Okay, it's true, but not true for testicular cancer. Of course, cancer more commonly occurs in older men, such as colon cancer, prostate cancer. But interestingly, testicular cancer can only happen between age of 18 to 38. Why? It's because the spermatogenesis is at its peak during this time. When a cell production occurs during this time, things are likely to go wrong. Because imagine that the engine is going on and on and on. When a trigger happens, then cancer occurs. Okay? The only reason why that we know risk factor of testicular cancer is undescended testicle. So the testicle is too warm and you're born with that, your risk of getting testicular cancer is significantly increased. But interestingly, if you Google testicular cancer, the most famous testicular cancer survivor is Lance Armstrong, right? Okay, Lance Armstrong, when he presented with testicular cancer at the age of 25, his cancer spread to the brain and his testicle allegedly was the size of a football. Only then they decided to go and see a doctor, get it removed. And Lance Armstrong famous is for two things. Number one, after his testicular cancer operation, he is the only person who managed to hold the Tour de France cycling competition 7 consecutive years. And he became an inspiration. And of course, you would think that with one less testicle, you're half of a man. He famously married Sheryl Crow and fathered about 8 children. So that, argument doesn't work. So the interesting thing is that virtually all the patients I encounter with testicular cancer always teach me one thing, is that this cancer is something that changed their life for the better. Do you know why? It's because it's so curable. It's 97% cure rate even at late stage. So a lot of my patients, after the initial fear, denial, anger, bereavement, then they decide to go for operation. Hopefully they trust what I do. And after the operation, which is a very simple operation, they may need to undergo chemotherapy and then they are cured. And a young man undergo trauma of life like that, they are so grateful for every breath they take, every step they make, everything they do. And that is a person with contentment in life and a person who will appreciate everything, all the people around them. And those are the life we should live. I must tell you, I learned many things from my patients, but that is the one thing that I learned from testicular cancer patients. Interesting fact about testicular cancer, it's a painless lump. So in medical school, we always teach the medical student, as a professor, I teach the medical student that testicular lump, which is painless, is cancer until proven otherwise. So don't consider all cancers are painful because testicular cancer is the contrary. And when testicular lump occurs, it will expand quite and large very quickly. And that means it was going to spread very quickly. But thankfully, this particular type of cancer is very, very receptive to chemotherapy. So my first job is to make the diagnosis. I will do a pregnancy test on the patient. Why? It's because the tumor marker for testicular cancer actually is beta-HCG, which is the pregnancy test. And after that, I will ask them to freeze their sperms and I'll do the operation to remove the testicle called radical orchidectomy. From that point onwards, we make the diagnosis, work out the best cocktail of chemotherapy to cure the patient, and hopefully the journey ahead is very bright. And hopefully they will inspire other people to live life like Lance Armstrong and many, many more sports personalities who unfortunately get testicular cancer, but thankfully cured from testicular cancer. And they are inspirational. On that note, Dr. G is signing off so that you're equally inspired like myself.
If you like our channel, please like, share, and subscribe.